Hi, welcome once again to PsychWatch, my YouTube channel on various psychiatric and psychological issues related to human being. Today we will discuss about an interesting topic which is prevalent across the world. 75% of individuals from birth to death, any part of in their life, experience severe stress, and most of those who are experiencing this stress may not affected with such problems, or they may adjust with these stressors and all, or they do have effective coping mechanisms. That's why they won't experience problem with these stressors. But 7.5% of people are totally shattered because of these stressful life events. That situation is known as post-traumatic stress disorder, or PTSD, which is very significant because after September 11 event, many of these Americans are even now experiencing post-traumatic stress disorder. Or those soldiers, those who worked in Afghanistan or Iraq, even now they are experiencing post-traumatic stress disorder. And in our day-to-day nursing practice or psychiatric practice, we may come across with individuals who are affected with this post-traumatic stress disorder. In DSM, post-traumatic stress disorder, acute stress disorder, and adjustment disorders are there, and which is coming under anxiety disorder. So we'll see post-traumatic stress disorder in this video. It is a reaction towards an extreme trauma that individual experiences, and that may leads to pervasive distress in that individual, and which can be results from various reasons like natural calamities, that is man-made disasters, serious accidents. If a person witnesses a crime or a violence, then he can have or he can develop this post-traumatic stress disorder in later life. In certain situations, victims of violence itself can experience this PTSD, rape, terrorism. So these are some of the severe stressful life events that predispose an individual for development of PTSD. And it's very important to differentiate between PTSD and acute stress disorder. I already mentioned PTSD, the symptom starts 1 month or after, whereas in acute stress disorder, the person experiences similar episodes within 1 month. So that is the difference between PTSD and stressful life events. Whereas in adjustment disorder, the person may have problem with the emotional symptoms as well as behavioral symptoms. So the symptoms will be confined to behavioral problems or emotional problems in adjustment disorder. In acute stress disorder, it may last within 1 month, or it will start within 1 month. Whereas in post-traumatic stress disorder, it starts after 1 month. That is the significance. Now we'll see what are the symptoms of this PTSD. First and foremost symptom is re-experiencing that traumatic events. After a period of 1 month, the person may re-experience whatever things they experienced at the time of that particular incident or traumatic situation. So that is the first symptom. Then sustained high level of anxiety. They will maintain a steady state of anxiety for a considerable period. Any effort taken by the individual will not be effective for controlling that anxiety. So that means normal coping defense mechanism won't work to solve that anxiety. That is another symptom. Then general numbing. The person may feel like he may not be able to respond effectively with normal life events. Then often people may experience nightmares. They will get out of the bed after seeing these nightmares. Many people experience anterograde amnesia. That means after that traumatic incidents, many things they will forget. In severe depressive episode, it's very important. The comorbid condition that is associated with PTSD is mostly depressive symptoms or depression. So depressive symptoms are major signs and major symptom that a person can experience. Then many a time people may experience guilt. Then many people turn to abusive substances or substance abuse disorders. Some may experience anger outbursts and aggressive behavior. That is also there. So with regard to this stress disorder, stress-induced disorder that I told you, it is post-traumatic stress disorder, acute stress disorder, and adjustment disorder. We can broadly classify that into five types. First one is normal stress response. It will get out of the patient's thinking, or the person will get relief from that area before 1 month. Then that is first type. Then next one is comorbid PTSD. Here the person experiences these PTSD symptoms along with certain other psychiatric disorders that is already present in that individual. That can be depression, that can be alcohol-induced disorder, alcohol substance abuse disorder, panic attack, and general anxiety disorder. If it is present initially and later, the person can experience PTSD. That is second type, that is comorbid PTSD. Next one is acute stress disorder that I already told you. If the symptoms starts 1 month, just within 1 month after the occurrence of the traumatic incidents, that is what is acute stress disorder. Then uncomplicated PTSD. The person may experience simply PTSD symptoms. There will not be any psychiatric comorbidities. In complicated PTSD, the PTSD will be the first one to happen. Later on, patient can develop psychiatric disorders. That is what is complicated PTSD, which is more commonly seen in people with borderline personality disorder, dissociative disorder, and sometimes eating disorders can be there, sleeping disorders can be there, sleep disorders that also can associated with this PTSD. That is what is complicated PTSD. One more important difference you must be clear about these signs and symptoms. In traumatic brain injury and PTSD, few symptoms are similar and certain symptoms are unique in these conditions. That is, traumatic brain injury, people may experience headache. That won't be there in PTSD. People may experience sensitivity towards light. That won't be available. That may not be experiencing in case of this PTSD. Nausea, vomiting, visual problem, dizziness. These are the specific features that you may get in patients with a traumatic brain injury. And we can see specific signs and specific symptoms present in PTSD. Flashbacks, avoidance, hypervigilance, then nightmares, re-experiencing life events, traumatic events. So which is unique for PTSD. Now we will see some symptoms that is present both in PTSD as well as in traumatic brain injury. That is irritability, cognitive deficits, insomnia, depression, fatigue, anxiety. So that means these are the specific symptoms which is present both in PTSD and traumatic brain injury. Now we'll see what are the predisposing factor. Various theories explains about development of PTSD, which include psychosocial theory, learning theory, cognitive theory, and biological theory. According to psychosocial theory, it is the traumatic experience, the same experience, same traumatic incidents perceived differently by different individuals. So how a person perceives that individual, perceives that a traumatic incident is significant with respect to psychosocial theory, which is based on the personality, the life events, the support, or everything which is associated with this condition. Then the individual. Individual means how that individual's personality is built upon, or what were the experience that person has, how much compact is their pre-morbid conditions. So everything decides. So that is psychosocial. Then recovery environment. If a person is getting proper environment, conducive environment for recovery, that individual won't experience this issue. That is what is psychosocial theory tells us about. Next one is learning theory. It is an experience, the learning process. It is the learning behavior. Behavioral theory that says that it is the learned behavior. That is why the person is showing this PTSD. Cognitive theory, which tells us about the cognitive aspects. That is affect, that is emotion, action, and thinking are interconnected. So it is because of the problem with either emotion, either thought or behavior that affects this PTSD like symptoms. Then biological theory, it is specifically associated with neurotransmitters. Abnormal neurotransmitters are causing problem with such conditions. Or it is because of the abnormal neurochemicals that happens. It is because of the response to stressors. That is biological theory tells us about. Now we will see management. In nursing management, important one is assessments. We need to assess the background data. We need to characteristics of symptoms. Then we need to differentially diagnose depression, whether this condition is depression or not, because it can mimic similar symptoms. Then of course physical and physiological functions of that individual, because when the person is experiencing this PTSD, their physiological functions are affected. They may not be taking adequate food. They may be affected with the sleep. So such conditions need to be assessed initially before doing any nursing intervention. Next one is of course nursing diagnosis. Post-trauma syndrome is a diagnosis. Complicated grieving is a diagnosis. Impaired thought process. Ineffective individual coping. Ineffective family coping. Powerlessness. Hopelessness. So many nursing diagnoses you can have with respect to such condition. Then regarding intervention. Pharmacological management, of course, anti-anxiety drugs are effective. Hypertensive drugs are found to be effective. Then regarding psychosocial therapy, cognitive behavioral therapy is very effective. Individual psychotherapy is effective. Group therapy, very effective. Family therapy, effective. And one important recent advancement in this PTSD is eye movement desensitization and response reprocessing, that is EMDR. It's a process by which the eye movement, because in PTSD it is found that abnormal eye movements, so by controlling, by desensitizing, by training, you are making the client to desensitize or decrease this eye movement. That is what is eye movement desensitization and reprocessing therapy is all about. That is also found to be effective. And final one is evaluations. Regarding evaluation, you need to reassess the client, find whether the interventions are effective or not, and once the interventions are found to be effective, you can either terminate the care. If the interventions are found to be effective, but if the person is still existing with these problems, you can continue that plan, and if it is not working, you need to modify the plan. So based on the assessment, based on the evaluations, you can decide whether to continue, modify or terminate nursing care. So which is very important. PTSD, you may get this one for university examination as a short note. So thank you for watching this one. If you have any doubt, you can mention in this comments. Thank you.